In the procedure we're going to do today, we're going to replace a posterior amalgam on a maxillary second premolar with a unique resin that actually is a very dense, almost like packable resin, until you place a sonic energy on the resin, which makes it like a flowable. The matrix we're going to use in this restoration is a Garrison Dental Solutions matrix system called the Composite Tight. And it uses a sectional matrix. As you can see, it's a small little matrix. It doesn't encirculate the entire tooth. And then we use a ring, and these are what they call the 3D rings. And the purpose of the ring is, again, to separate the teeth evenly from the gingival floor to the marginal ridge. As you see from this photo, how tight the contact is, how well this fits against the tooth, and as you can imagine, there's not going to be much excess to remove. There's just no place for it to go. So finishing will be much quicker and much easier for us with this resin. So in this particular case, I'm going to be using Kerr's Optibond FL, and I choose FL because it's a 4th generation adhesive that's been on the market for almost 20 years. Also, it will adequately, and certainly the researchers there, that it'll bond to etched enamel as well as dentin. So we're going to etch the enamel. Typically what I'll do is I'll put it around the enamel periphery first, then I'll fill up the rest of the preparation, etching the dentin, count to 10, and then rinse. After we place our etchant, and this is a 35% phosphoric acid, we're going to rinse thoroughly, and then we use a high-speed vacuum, our suction tip, to remove the excess moisture. We don't want to over-dry the preparation. With our total etch, quote-unquote, damp technique, we want to make sure we don't have too much water, but we don't want to desiccate the tooth. Now we're going to place our primer, and this is a 2-part system where we have our hydrophilic primer. So you can see here where I use a small microbrush with a hydrophilic primer. This is alcohol base. This is Optibond and FL number 1. We're placing it multiple coats to make sure that it completely saturates that etched dentin and enamel. Typically it'll take about 15 to 20 seconds. Then we need to air dry thoroughly, and this is a critical step. We want to make sure as we air dry that now that creates a hydrophobic layer, because we're going to follow through with a hydrophobic resin. Our next step is to place the hydrophobic resin, and this is the bottle number 2 of this 2-part system in the Optibond FL. It's lightly filled, so you can see as it adapts to the preparation, we're going to rub it on both on the enamel and the dentin. And then we're going to air dry thoroughly, just to thin it. And there's no hydrophilic carrier, we just want to thin that. And then we're going to light cure thoroughly in typically about 10 seconds. And this one has a photo initiator in it, so we want to cure it. We want to set the hybrid zone, so now we can place our restorative. This material has very low shrinkage, which means we're not concerned about, when we polymerize it, breaking the dentin bond. Secondarily, it has a 5 millimeter depth of cure. That's 2.5 times what we see with most of our composites on the market. So we're not going to incrementally fill. We're not going to use a flowable because, as you see this material, as soon as I put my foot on the rheostat and it comes out the tip, it acts like a flowable. And so we have great adaptation at the floor of the box, which we're always concerned about that. Great adaptation against the walls of the preparation, the gingival floor, the pulpal floor, and against the matrix band. So we put the tip in, just like as we do an endo-type fill, at the base or the floor of the box. If you're doing a class 1, it would be on the pulpal floor. As we extrude, and you can see it's very flowable, as we extrude it through the tip, we just lift the tip out of the box. So we're basically backfilling it. Once we fill it, and you can see it here, now this flowable composite, now that the sonic energy is taken away, now it becomes like a very dense condensable. And you can see we can actually condense it or pack it, almost like an amalgam. It's totally different than any of the other resins we use on the market that are available. We can condense it, we can carve it. You can see how fast that filled up. It was less than probably 30 seconds and it completely filled the cavity preparation. Now I'm going to carve the excess. You can use a half Hollenbeck or whatever you like to kind of shape your marginal ridge. And then we can light cure. You know, the curing lights we have now, especially the Plasma Arc, and I'm using the Demi Plus from Kerr, and they have a greater depth of cure. They're more powerful, quieter, lighter than the Plasma Arcs that people said were so great several years ago. These are great lights, so make sure you have a good light. Now we're going to remove the matrix band. Typically I'll remove the ring first, then the wedge, although you could take the wedge out first in this particular system, and then we'll take the band out. And the band is Teflon coated, so you notice the composite doesn't stick to that like we had with some of the systems in the past. You know, in summary, you saw how easy it is. You saw how dense it is. We don't have to worry about air voids, or as we pack multiple layers, creating air voids. We're not using different materials, first a flowable, then another material. It's time saving. In fact, I've probably spent more time talking about it than it actually took me to do the cavity preparation and the placement. I mean, typically I tell people under 3 minutes and closer to 2 minutes on these MODs, DOs, or MO restorations, and you can see how nice this restoration looks.